Hi everybody and welcome to an episode of Hudson Health. My name is Dr. Angel Lazo and I'm with RWJBarnabas Health. And I'm here with my co-host, Dr. Akunyili.
Hello everyone, my name is Dr. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. And today we're going to have a very exciting guest, not because he's an emergency physician like me, but because he's just an amazing asset to our community, Dr. Schubert Perotte. He's the chair of our emergency department. We want to talk about emergency care, right? We've talked about cardiac care, women's health, primary care, bariatric care. It's just such an extensive list of specialists, but emergency medicine is a specialty, so we're going to talk about that.
Yeah, and especially the medical center. I mean, the medical center is the hospital here in Hudson County. It's a full service facility. And again, they're representative of the community by the ER that they have, you know, because we have a new ER. It's only about a year and a half old. I'm sure he's going to talk about it. But emergency medicine is actually very important. I mean, it's sometimes a starting point for where patients actually get their encounter. Absolutely. So without further ado, let's bring Dr. Perotte.
We'll be right back.
No one plans on heart disease, but everyone should have a plan for it. We help patients of all lifestyles and medical histories plan for healthy hearts. We offer convenient screenings without judgment, hundreds of preventive programs, and women's heart specialists. And we're the largest cardiac surgery program in New Jersey. Make plans for a healthy heart with RWJBarnabas Health. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one path stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back to Hudson Health. My name is Dr. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health.
And my name is Dr. Angel Lazo, and I'm with RWJBarnabas Health at Exchange Place. And today we're going to have Dr. Perotte from the emergency room coming. So I'm really excited about actually having a conversation with him. Primary care and emergency medicine are the thing. So I'm very interested in learning a little bit more about the ER and what's actually offered, because being a full service hospital, I'm interested in knowing.
I am absolutely biased, of course, as an emergency physician, but I think the emergency room is the front door of the hospital and the health system. So we're going to talk to Dr. Perotte about the numbers. How many patients do we see a year? We know that number keeps increasing every year as the population increases. But in addition to being an emergency room, it's also a full level 2 trauma center. So what does that really even mean? That's an incredible asset, the only one in Hudson County. So we want to talk to him and what that means, not just in terms of a label, but what resources a level 2 trauma center needs. But very close to my heart is the Chief Medical Officer and an ER doc is the patient journey. So all the bells and whistles only matter as much as it's a seamless journey for a patient and they can get the care they want. Nobody wants to come to an emergency department, unfortunately. Nobody ever sees me on their best day, but when people do come, we want to make sure they're getting the best and most efficient care. So we're going to ask him about that.
And again, it's probably very underappreciated, you know, especially from the patient perspective, because, you know, they're coming in sick, whether they arrive by an ambulance or they're actually dropped off at the emergency room. It's typically not when people are at their best, you know, but again, they do all takers. So irrespective of what the condition, and especially being a full service hospital, dealing with trauma, pediatrics, you name it, they have to deal with it. They are the experts in stabilizing individuals and then passing them on whether they need admission or not. But medicine has changed a lot. And a lot of it is actually reflected in the emergency room. I mean, I do primary care, and I still see a lot of my patients that actually end up in the emergency room instead of contacting me. So the emergency room still continues to be actually a place where a lot of patients go to seek primary care. And it may or may not be appropriate, but obviously the ER will see all comers, you know, which is very, very, very rewarding.
Absolutely. It is that place 365 days, 24 hours in our society where anybody, regardless of pay, gender, wherever you are, you can get help.
Yeah.
But we do want people absolutely follow up with their primary care doctor, and that's something we'll ask Dr. Perotte. If we have time, because there's so much to discuss, we probably want to ask him about summer injuries, right?
Absolutely. And we're going to
Swimming,
yeah,
barbecues.
absolutely. Talk about the summer. Yeah,
all-
dehydration,
all
sun
things summer.
poisoning. Absolutely, all things summer.
Right, because there's a spike in injuries during the summer, whether it's trauma or,
Correct.
you know, pediatric drownings, which is usually
Right.
very tragic every time a child has a drowning or near drowning episode, and heat injuries, especially in the older, elderly and children. So we want to ask him about what we can do to mitigate those.
And he's going to talk about his new ER. I mean, the
Yes.
new emergency room is only about 1.5 years, and it's very special. It's very different. It's almost like a paradigm shift in emergency medicine. You know, in fact, the shift in emergency medicine is actually more tailored now specifically because patients sometimes go to the emergency room and they get upset. You know, they see someone go before them, but they have no idea, you know, how long that patient really was there, what their need is. So it's not anymore that you just arrive at the emergency room and then you're just singly triaged. So there's a whole different mechanism, which I'm sure he's actually going to elaborate on.
Absolutely, it's a triage system which we want to ask him about, and we also want to ask him about, the brand new ED, which is absolutely beautiful,
Yeah.
and just something this community should be very, very proud of.
They really should. I mean, it's the full-service hospital. It's a trauma-level trauma center. You have all the experts. You got trauma surgeons. In fact, it's interesting because actually trauma started with war, and it's actually been perfected. This is where hand surgeons actually came from. It came from war. I mean, since the beginning of time, man has always been able to calculate exactly what they do and how lethal they can be, and that's really how trauma started. So to have a full service, including a trauma center in Jersey City, is a real asset actually for our community. And I think our community knows that and appreciates it, I believe.
And we'll talk to him about the golden hour of trauma care, which means that having this in this community means people do not have to travel, you know, farther away, which is, especially in trauma, you don't have the time. You actually have 1 hour to get that specialist care close to home.
Correct.
Hopefully you don't need it, right? That's always the prayer, but
Hopefully
if you do,
not.
we are open.
But again, with trauma, and they have to be helivac, they send them in, or they send them out.
All right.
So, very exciting. So I'm really looking forward to actually talking to him.
Yes.
And I especially want to get a feel for example, because we have a lot of not just the surgery centers, but we have the urgent centers. And
That's
what
a good
impact
point.
has the
That's a
urgent
good
center
point.
had on emergency room visits, for example? Because I personally get upset when a patient ends up going, not to me or calling me, but they end up going actually to an urgent center or something like that when they're having crushing chest pain or something like that, when they really should be at the emergency room. So I think he's going to speak about some of those things.
All right. We'll be right back with...
We'll be right back. Thank you.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants. All major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Everyone, welcome back. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health. And we have several guests, but today's guest is near and dear to my heart because he is the Chair of Emergency Medicine at Jersey City Medical Center. Dr. Perotte, please introduce yourself.
Hello, how you doing? My name is Dr. Schubert Perotte. I'm an emergency physician. I'm born and raised here in New Jersey. I grew up in Elizabeth and Linden, New Jersey. I went to Rutgers, in New Brunswick, and I also went to medical school at RWJ. So, then I did my residency both here in New Jersey, and I've been working all up and down the East Coast. And I wound up just being right back here, right in good old New Jersey. And I'm here at Jersey City Medical Center now. I've been here for the past 4.5 years, and it's been a great experience. It's been a lot of growth, a lot of change, but all for the good. So I'm excited to be here and to progress the emergency care for both Jersey City, the county, and for all of New Jersey.
Very excited, and you can tell my excitement because I'm an emergency physician as well, and I do work some shifts for Dr. Perotte. So, tell us about the ED, the Emergency Department of Jersey City. How many patients do you see a year? What percentage of them are children? Just what are the basic statistics about your department?
So to really sort of break it down sort of as averages so people can really understand the size and scope of it, last year were probably around 220 patients on average per day. This year, so far, we're at around 240 patients per day, really approaching 250. And, there are fluctuations. There are days when we'll see close to 300 patients a day. There are days when we'll see some close to 200. So, we meet sort of in the middle, and those are really sort of our working averages. We're getting close to 90,000 visits per year. And, and it continues to grow. We have an exciting brand new emergency department that's been around now for about a year and a half. So, we have more space, and, the adage is, if you build it, they will come. So here we are.
And the medical center offers just a full gamut of services, including trauma, so tell us a little bit about that experience in the emergency room, because it's very unique. The medical center is the only one in Hudson County that's really a trauma designated. We have open heart surgery. We got our structural heart program going. So tell us how because that starts in the ER.
Yep, it starts near and dear to my heart in the emergency department. And it's always exciting when there's traumas that come around. But what most people don't understand, to actually become a trauma center, there are a lot of coordinated steps and a lot of services that have to really be available. And you're talking about trauma surgeons being in-house 24/7, anesthesia to really put patients to sleep in case they need to go to the operating room. Radiology and their services have to be around to read. There may be multiple things happening in the emergency department. When trauma comes around, they get moved up the ladder so that those things get read sooner rather than later, so the determination of what happens to those patients in the next hour is really critical. So we need to really get that information in. And there are a lot of other resources that come into play for trauma patients and for the whole entire hospital to really be able to take care of those, because the surgeons can do certain things, but they may require other services in the hospital just the same, and those folks have to be available in multiple different specialties, let's say orthopedics to neurosurgery, all those things to oral maxillofacial surgery. So there's a lot of other practices and groups that are involved in taking care of a trauma patient. Not, it does start there in the emergency department, but it's really the whole building that actually gets involved in taking care of these patients.
Especially trauma, because trauma's roots are actually in war. I mean, you're talking about the beginning of time.
Correct. This
is where, through trauma is where we ended up with hand specialists, et cetera, but it's very unique that actually the medical center is the place actually here in Hudson County.
Yep, and it's serving Hudson County, and the numbers and the volume continues to rise. And, there are different things that come in for trauma, and things that are what we now call the golden hour. Is when the patient comes in, the rapid assessment of that patient and really providing life-saving care is really critical in that first hour. So having anyone in the county having to travel anywhere that causes distance, traffic, and really takes up a chunk of that critical first hour is really, really important. So having something in the county where everybody can converge and all the patients in care could be taken care of sooner rather than later is really a gift to really have for the county.
That's fascinating, and we look forward to talking to you not just about trauma, which is just great work you're all doing, but about the patient journey.
Yep.
I know you've made a lot of improvements in reducing wait times and improving the patient experience. So we'll be right back, because that's very fascinating work we want to hear about.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panepintodevelopment.com. Panepinto Properties, building Jersey City for everyone.
Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi, everybody, and welcome back to Hudson Health. My name is Dr. Angel Lazo with RWJBarnabas Health at Exchange Place, and I'm here with my co-host, Dr. Akunyili.
Hello again, I'm Dr. E.G. Akunyili. I'm Chief Medical Officer of Jersey City Medical Center, facility of RWJBarnabas Health, and we are here with Chair of Emergency Medicine at Jersey City, Dr. Schubert Perotte. Welcome back.
Thank you.
So we left off talking about the patient journey. What happens when people come to emergency room? Most times, the scariest period of their life, and what should they expect? What does the journey look like, and how has it been streamlined?
So the journey has changed drastically over at Jersey City Medical Center. When we go from a place that was built many years ago to this new emergency department, that invariably there are going to be changes. So one of the big changes that actually happened is we went from having only one triage area where everyone who walked in or who was dropped off in front of the emergency department walked in, they only got seen in just one area by one nurse. But now with the new, larger emergency department, we actually have 5 triage areas, 2 for pediatrics and 3 for adults. So now patients can be spread and seen in multiple different triage bays, allowing the flow to be a little bit more continuous and efficient with getting patients assessed and also brought into the actual emergency room. And there's different things that change. It really sort of ebbs and flows. We prepare for the busiest of times. And also we understand that there are times when it's less busy. So, so the resources are really sort of tailored for that. And what a lot of patients don't understand is that, there's different areas of the emergency department that take care of different things. So you may come in with one complaint and you may see someone else go in before you, but what you don't know is that they'll have multiple different things going on with them that are complex, and even if they may look well, but when you put them on the machine to really check out some of their vital signs, their temperature, their heart rate, their blood pressure, things of that sorts, some of those things can be very, very abnormal, and we need to react to those things sooner rather than later.
It's very interesting how medicine is always evolving, and especially the emergency department is probably one of the things in medicine that has actually evolved the most. A lot of patients actually end up going to the emergency room, which they really shouldn't. They should have primary care. But again, a big sector of our population still doesn't even have primary care, and yet they end up in the emergency room. I know that we have now, for example, like these surgery centers that are available, these emergency centers that are available. What impact does that have on your emergency room?
So, so for us in the emergency department, we are welcome to all comers. And there are times in which, the patients come and see us. We're like, hey, we try to give them some good, friendly advice. Like, hey, this is something that you could follow up with your primary care doctor. And we try to encourage folks to really follow up, because your primary care doctor really serves as the really central place that keeps all of your records together, that can also give you good direction on where and who to see next, and really sort of make sure that they have some accountability for your journey and your health, in that process. The emergency department, you may see someone very different every time you come. So, the care may be a little bit different, really addressing the emergency, but our specialty is really addressing those really very acute emergencies, those things that happen to you today, 2 days, 3 days. But if something's been going on for months, years maybe, the emergency department is probably not the best place unless those things have really sort of had a chronic history and really have gotten significantly worse in a very short period of time. So it's relatively an even exchange, but we try to encourage. We want all of our patients to really fall in and really see their primary care physicians. And if they don't have one at Jersey City, we are now opening up several other off-sites. And we are also prepared to really channel the patients into primary care offices where it may have been difficult in the past. You know, we as an institution are now clear that, you know, this is a need for the community, and we're prepared to actually provide you with those places to actually go to see your primary care sooner rather than later. Despite any and all circumstances, we will work with you. We have multiple resources that can also work with you to really help you get to the specialists or to the primary care mostly that you really need.
We have the luxury actually because we have Epic and we share it in the institution. In my practice, for example, I have direct access. I know what was done. I get the communication from your ER, which I think is a real benefit actually to the residents of Hudson County, because that continuity of care is there.
Correct. And the information is just so fluid now, and it happens so quickly.
So we have less than 30 seconds, but I wanted to ask you for our audience, I know we're going into the warm summer months. What are the things that you see most that people should be worried about in terms of safety, whether it's life safety and drowning or heat safety?
Yes, we want people to get out and be careful. Don't go out during the hottest part of the day. Stay out of the sun. We want you to get your exercise in, but get in early or get in a little bit later when the sun is dying down. Follow all your safety precautions. They're there for a reason. When you're out at the pool, don't jump in head first. Feet first, always. You know, make sure you watch your children and the kids that don't know how to swim, because they're always on an adventure, and sometimes those adventures are tough. And you know, it's really up to all of us to make sure we keep our communities safe and avoid them having to come to the emergency department. But if you do, we're ready, willing, and waiting to take care of you.
On that note, thank you very much, Dr.
Thank
Perotte.
you, Dr. Perotte. Thank you
Very good,
much.
thank you.
So we'll be right back and after this commercial break. Thank you.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design studio and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Comprehensive healthcare is here, here, and here. RWJBarnabas Health is healing, enhancing, and investing in Hudson County with its two newest locations, Hoboken and Exchange Place. Within walking distance or accessible by mass transit, our locations combine convenience with primary and specialty care, including cardiology, women's health, orthopedics, cancer care, and more. Let's be healthy together.
Hi, everybody, and welcome back to our last segment of Hudson Health. My name is Dr. Angel Lazo with RWJBarnabas Health, and I'm here with my co-host, Dr. Akunyili.
Hello, everyone. My name is Dr. E.J. Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJBarnabas Health.
So what did you think about Dr. Perotte?
Oh, fascinating, fascinating. Well, before we even go into Dr. Perotte, like just talking about the brand new emergency department, and just that as emblematic to all the expansion that's gone in Jersey City Medical Center. It's the 20th anniversary on Grand Street, and the ER and the orthopedic rooms, there were recent additions. Of course, we have to mention under the leadership of Michael Prelitsky, the CEO.
Absolutely. They should be very proud, actually, of the what they've been able to actually do for the community. So very proud.
Yeah, it's been a phenomenal run, and this ED is just the latest example. Many communities don't really invest in emergency care. You know, when I trained, it was sort of that place in the basement where nobody went to.
Right.
But to have this beautiful, airy, amazing space for this community for the time of greatest crisis, that's incredible.
And again, the practicality of how they're able to triage patients now, not just singularly, but depending on the urgency and the need and whatnot. Again, it's all about patient flow and the patient experience. You know, we do want our patients, especially, you know, because they're sick, and especially if you come in an emergency room, you're typically not at your best.
Yes.
But we want to offer the best possible care as quickly as possible, because, you know, time is muscle, time is life. So those seconds that you know, for stabilization and so on and so forth, having a competent emergency room that can do that, to cover the full gamut, to include trauma, it's just such an asset for the community. such an asset.
Incredible. And the numbers he referenced, seeing about between 240 to 300 patients a day, up to 90,000 a year. Just to think of the scale of those operations in and of itself, that's phenomenal. And then he also talked about what it took to have a trauma center. It's not just a sign on the door. It's a trauma surgeons, it's a nurses, the techs, radiology lab, everything around the clock, all in service of this community, should they have a trauma.
It has to be available 24/7.
Absolutely.
Available 24/7. But I love the fact that, you know, especially in our community, in our emergency room, that we share an electronic medical record. That I see everything that happens in everything that happens actually inside the emergency room. So I have full access, you know, to everything that's actually done. So it's phenomenal. It's just unfortunate that we still have a lot of primary care patients that are still relying on the emergency room and or on these urgent centers, you know, and they really should be following their primary care. And that's one of the things that I'm very proud of, that my patients do not get lost in the shuffle. You know, I do get notified, I do share the same record, there is constant communication for the continuity of care.
Yeah, absolutely. Of course, Dr. Perotte emphasizes that the emergency room is always open for anybody who wants emergency care, but being an integrated healthcare network with a huge array of phenomenal primary care doctors, we do want people to follow up for continuity of care with their primary care doctors. And our emergency room obviously remains open for anybody who wants it. So he talked about that.
And again, the recommendations, some of them maybe are very practical, you know, especially now for the summer. You know, a lot of kids are going to be swimming, a lot of adults are going to be swimming. Again, the re-emphasize, do not dive in head first, go feet first, et cetera, you know. Recommendations on heat stroke and what you should do in the summer, make sure you stay hydrated, et cetera, et cetera. These are all very useful tips for our community.
Well, agreed. Remembering that, for example, just talking about drowning, that's one of the leading causes of death in children in America. So really having somebody as a designated watch for neighborhood parties, it is perhaps one of the most traumatic things you can see as an ER doc to handle, to deal with a family who's lost their child from drowning. And I've seen that early in my career. So definitely water safety, but also safety. He mentioned exercising, always exercising, same theme, but do it in the morning or later at night, and make sure you're getting your water, wearing your helmet.
Yes, absolutely. You know, because we had spoken in previous segments about, you know, exercise and so on and so forth. But unfortunately, a lot of these things, it always ends up in the emergency room, you know, and they have to be able to basically handle just about every possible situation. So I'm very proud actually to be part of the RWJBarnabas Health System in Hudson County, because we do have the leading hospital in Hudson County, and we offer an incredible array of services for our demographic, our patients.
Absolutely, and you know I'm incredibly proud of this segment as an emergency physician. You know why I went to emergency medicine was I felt like this was the one specialty where our doors were always open to anybody 24/7. But it's incredible to watch the growth of this emergency room, but even with our primary care docs, I think just having that whole network, we can do so much more for this community.
And the experience that they have to have. I mean, they have to basically cover everything. I remember when I did training, one of the best rotations that I had was actually emergency medicine. The part that was very difficult to me was, you know, when you let the patient go and they got admitted, you lost track of the patient. That's one of the things that made me not go into emergency medicine was I would lose track of the patient.
Oh, there's always a new patient.
Always. Anyways, thank you very much for, it was wonderful to have Dr. Perotte.
He was amazing. Thank you for watching. Until next time.